Hello everyone. Today, we're delving into the world of a medication called Glimepiride, commonly known by its brand name, Amaryl. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Glimepiride, sold under the brand name Amaryl, is an oral diabetes medicine that belongs to the class of drugs known as sulfonylureas. Its primary function is to help control blood sugar levels by stimulating the release of insulin from the pancreas. Approved by the FDA in 1995, Glimepiride is primarily prescribed for the management of type 2 diabetes in conjunction with diet and exercise. It can be used alone or in combination with other diabetes medications to improve blood sugar control. Unlike some diabetes medications, Glimepiride is not recommended for use in patients with type 1 diabetes or diabetic ketoacidosis. Warnings: Glimepiride comes with its set of precautions. It's crucial to be aware that this medication can cause severe hypoglycemia, low blood sugar, especially in individuals who are elderly, malnourished, have kidney or liver problems, or who are using other medications that lower blood sugar. Hypoglycemia can lead to symptoms such as headache, hunger, sweating, irritability, dizziness, nausea, fast heart rate, and feeling anxious or shaky. Severe hypoglycemia can cause seizures, unconsciousness, or death. Before taking Glimepiride, inform your healthcare provider if you have a history of heart disease, liver disease, kidney disease, or if you have a condition known as glucose 6-phosphate dehydrogenase (G6PD) deficiency, as this can increase the risk of hemolytic anemia. Before taking this medicine. Before starting Glimepiride, several factors need consideration. Inform your healthcare provider if you are allergic to this medication or any other sulfonylureas. Given its impact on blood sugar, those with kidney or liver diseases should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Glimepiride may not be recommended during pregnancy as it can cause hypoglycemia in the newborn. Regular monitoring of blood sugar levels is advised for those with diabetes or at risk of diabetes. You should not take Glimepiride if you have diabetic ketoacidosis. Instead, your doctor may prescribe insulin to treat this condition. Inform your doctor if you are using any other diabetes medications, as some combinations may increase the risk of hypoglycemia. Side effects: all medications can have side effects, and Glimepiride is no exception. Common side effects include headache, nausea, dizziness, and fatigue. More serious side effects can include severe hypoglycemia, jaundice, yellowing of the skin or eyes, and dark urine, which can indicate liver issues. Additionally, there's a potential for allergic reactions, which may present as rash, itching, swelling, severe dizziness, or trouble breathing. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Furthermore, Glimepiride may cause hemolytic anemia, especially in individuals with G6PD deficiency. Symptoms of anemia can include fatigue, pale skin, shortness of breath, and dark urine. If you experience these symptoms, seek medical attention promptly. Interactions: Glimepiride might interact with other medications. It's important to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Medications such as beta-blockers, clonidine, and reserpine may mask the symptoms of hypoglycemia. Alcohol can increase the risk of hypoglycemia and should be consumed with caution. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Glimepiride. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended starting dose of Glimepiride for most adults with type 2 diabetes is 1 to 2 mg once daily, taken with breakfast or the first main meal of the day. The dose may be gradually increased based on your response to the medication, but the maximum recommended dose is 8 mg once daily. It's important to take Glimepiride exactly as prescribed and never alter your dosage without consulting your healthcare provider. Avoid: while on Glimepiride, it's advisable to stay hydrated and follow a balanced diet to help maintain stable blood sugar levels. Given the potential for dizziness or drowsiness, it's wise to avoid activities that require full alertness, such as driving or operating heavy machinery, until you know how this medication affects you. Avoid alcohol, as it can increase the risk of hypoglycemia and exacerbate certain side effects. FAQ. Many wonder about the age restrictions for Glimepiride. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Glimepiride. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.